Welcome to our press conference to discuss the 2024 priorities for the Endometriosis Working Group. March is Endometriosis Awareness Month, and as those of us up here and on the Endometriosis Working Group know, endometriosis impacts 1 in 10 individuals in the United States, and yet it is still a very misunderstood, underdiagnosed, and under-researched disease. And so the Endometriosis Working Group was formed in 2021. We are a working group of legislators, of providers, of individuals impacted with endometriosis who come together to better learn about the disease and make recommendations for how we can improve conditions here in the state and across the country. And so this year's policy priorities include a number of things to continue to build on, but also some new priorities. One of our top priorities is to ensure equitable fertility care here in the state of Connecticut. We want to make sure that if someone is experiencing endometriosis, they can get the fertility care they need, regardless of their economic background or their gender identity. We also want to expand Connecticut's paid sick days legislation. Connecticut was one of the first states to enact paid sick days, but we have fallen woefully behind other states in that policy, and it would impact those experiencing endometriosis in the state of Connecticut. And we want to continue funding for the very important entity, the biorepository, which is now called EndoRise, that this working group really worked tirelessly on to get enacted here in the state. It's the first of its kind in the country, which will help lead Connecticut and other states in finding treatment and diagnosis for endometriosis. And so we have some additional policy recommendations that would be ongoing, including menstrual education for students, increased education through a school nurse program, as well as addressing women's pain and how it is often overlooked, ignored, and just women are made to feel like it's all in their head. And so we have an ongoing discussion here at the legislature on that work as well.